Hello, this is week 15 of HSCI 6262. We're talking about knowledge translation this week. So, knowledge translation really focuses on this idea that you have generated new knowledge through the research process, and we've been talking about making a research process community engaged or community informed and also policy informed throughout this course. And so now you're trying to turn that knowledge into some kind of impact and some kind of outcome for the community. So if you really have community engaged research going on, then community members, and regardless of who that community will be involved throughout the entire process. So from idea generation all the way to the end where you're writing the paper and disseminating the information. Communities can actually help you disseminate your information in a way that's actually likely to reach more people than just putting it in a peer-reviewed journal. In some ways, just publishing in a peer-reviewed journal just locks your information up away from the rest of the world. As many of you know, peer-reviewed journals charge money to access their information. So most of the general public is not going to see something when it's in a peer-reviewed journal. They will see it if you use some alternative means of getting it to them. So whether that's a website that a lot of people look at in a particular community, or whether it's some newsletter, or getting some particular individual to talk about your research findings, let's say some local political figure or celebrity or some respected doctor in a particular hospital to talk about your findings. Those other alternative means are likely to actually help your knowledge lead more to application. So there are a variety of ways to go about this, of course. The point here is just to emphasize the point that knowledge has to transfer over to the community that you're focused on in order for them to really be able to benefit. So after all this work you've done, you don't want to have it just sit on the shelf. You want the information, especially if it's very useful and likely to impact the health of these individuals you've been focused on, or likely to improve the quality of care being provided by some health professionals and so on, some kind of positive impact. You don't want the knowledge to just stay, caged up. You want it to get out and actually influence the individuals you meant for it to have an impact on. All right. So this is just one model that was presented in the reading on one of the websites you had, where the Canadian government really does a good job of focusing on how best to do this. We in the U.S. we refer to it mainly as dissemination. Often in an NIH grant, you may have a dissemination plan. Some grants require it. Occasionally, some RFA might say, well, you have to have a dissemination plan for this particular grant. Others would like to see it, but they don't really talk much about it. But the idea is that at some point, you've got to get the information out. The basic way that we disseminate information is just through journals. But if you really want to, as I said, reach more, you've got to more people. You've got to think about other approaches and other options. So here, this is just demonstrating how you go from an application at the bottom where you have some problem you're looking at to incorporating community information, adapting the knowledge to a particular group of people, assessing barriers to getting this knowledge to people, tailoring, your various interventions, of course, that you're going to use, and monitoring whether or not you pass on the knowledge, evaluate your outcomes, evaluate whether knowledge reaches people or not, and then sustain the use of knowledge. So, one good example of this is, let's assume that you are generating a website that's supposed to inform people, provide people with information on how to engage in asthma management. So you've identified there's some problem with asthma management. You're trying to get information out to people. You perhaps have done a research study to demonstrate that your website can be useful. So now you're going to look at all the different ways you can market this website and get it out to individuals, and You're going to figure out what barriers exist. For example, some people don't have access to the internet, so how do you get it to them if they don't regularly have access? Maybe you use maybe use mobile phones, maybe you use libraries, maybe you use schools, maybe you use some kind of community center that they can easily access, or you think about other solutions. Maybe you need a paper version of what you're creating so that people can actually use it. So you get it out to them, then you could assess, well, is it working or not, and monitor whether or not people are using it. If it's a website, you can actually look at hits. You can look at which particular pages on the website people are using the most frequently. You can go back and evaluate, was this a success or not? Did it actually have some outcome that you predicted it would have? And frankly, this is the case with any type of, sorry about the fire engines in the background here, sitting in the city in my office in DC. So with any kind of clinical research, you're interested in figuring out, well, what were the long-term outcomes? If you can actually get to that point and you're actually seeing some useful outcomes, you want to examine the outcomes. So in this case, you want to assess whether the knowledge actually reaches people or not, and is it sustained? Are they actually continuing to utilize that knowledge, or does it sort of fade out? Once you stop the project, you realize that people aren't really using it anymore. You haven't created some way to sustain the use of the website. You haven't integrated into a health system, for example. Maybe your asthma management website should be integrated into a hospital or into local clinics, and the way that they practice maybe should be used as something that some particular clinic refers patients to, or a hospital refers patients to, or maybe an insurance company should utilize it, and so on. So taking that next step to really figure out, well, how do you transfer the new knowledge that you've generated, and how do you actually assess whether or not it's working? And this might not be something you as a researcher would be interested in doing. You may just want to generate the knowledge. For example, there's some basic science researchers who just really want to generate the mechanism for a new drug, but they don't want to go down the route of actually producing the drug. So really, what they're trying to do is pass on their knowledge to the clinical researchers who can pick it up and actually develop a new drug and try to test it using the mechanism that the basic science researcher has created. So the point here is not that you wouldn't necessarily be doing all of this. Some of you might be and would be interested, and some of your projects actually look something like this. But you may not be doing this kind of work, but you should have some foresight that in the future your work could be disseminated in this way, and it could have a greater impact on people if you really spend some time thinking about, well, how will it eventually transfer, and how will it shape and change knowledge in my particular field of interest. All right. Here's a chart from one of the readings that you had, which simply illustrates that um, funders are spending some money on knowledge translation. They tend to spend money in certain ways. So they're spending quite a bit of money on workshops. As all of you know, there are a lot of workshops out there where information is really being communicated to you and other types of professionals. Publications. So we all know that publications is a basic way that we get information out. And probably, perhaps beyond the publication, what's even more important these days is that the publication gets into a database. So without these databases and without the ability to query databases, then really publication doesn't mean much at all. So really getting the publication into a database, and that's something you always have to be cognizant of when you're publishing. You got to make sure that wherever you're publishing your work, that is going to be indexed into some major database. So usually you're looking to see if your if the publication you've selected is being indexed in Medline. So if it's not indexed in Medline, it's not going to get into PubMed, so it won't get into a realm that the public can easily access it. And even your own health professionals, your own colleagues would actually have a hard time getting the information. So it won't transfer well, right? If you don't actually get into those journals. Dissemination, I'm not sure what that means. All of this is really dissemination. So I'm thinking maybe that's some alternative approaches to dissemination beyond publication that funders pay for. translation into other languages. This can be important. It's often important, more important for people who don't speak English. English seems to be the most common language right now in terms of discussing scientific findings. So it's the dominant business language out there these days. But you may want to translate your information into a language that's useful for a particular patient population, right? So, given that asthma management example I was talking about, you might want to translate your website into Spanish or Mandarin or some other language that's appropriate for the population that you're working with. If you're in a place like San Francisco, you might want to translate your material into 6 or 7 different languages in order to make sure it reaches the people who need it. That's, again, that depends on the type of project you've created. Web development, more and more funding is going towards using the web to disseminate knowledge, and it's usually I'd say, for the generation of people who are in their 30 somethings and below, this is sort of what people usually think of the most when they think about disseminating information. The problem with a website is that it still needs to be marketed. So you can't just go create a website and assume that, well, the whole world has access to this. Well, you know what? The whole world has access to millions of websites. So how do they get to yours, right? So you've still got to market the site. You got to inform the appropriate people that it exists. Otherwise, the website will sort of sit there dormant, and no one will use it. And it can be nice and pretty and so on, but it really won't have any impact, and the knowledge really won't transfer to other individuals and the people you need to know about it because you're not doing a good job actually marketing it. So if you're thinking about some kind of web development approach or website approach for disseminating information, always think about, well, how will people know about that website? How will I really truly get it out to the individuals who need it the most? All right, I just wanted to briefly mention this funding option. PCORI has a number of different patient-centered grants that exist. The PCORI funding is very relevant to what we've talked about throughout this course, and it's definitely relevant to this particular week because PCORI has a communication and dissemination research grant program. So there's a link to it. That link is to all of the funding announcements for PCORI. So just take a look at those. If you haven't considered PCORI funding and you're doing something which is patient-centered, which is either focus on the needs of patients in a particular community, or which is a comparative effectiveness study, because for some reason PCORI includes comparative effectiveness as being patient-centered, even though it's not always patient-centered. So if you are thinking about doing a retrospective or prospective comparative effectiveness study, PCORI might be the funder for you. So take a look at their funding options. They have a lot of money. Their funding is tied to Medicare. Their funding is tied to insurance companies, and so they're going to be getting money every year based on the number of people who are insured by private insurance companies. So that's essentially automatic money that will be coming into the door for this funding agency, and this is very unique for a government funder to receive money in that way. And they're going to be getting about 3.5 billion over the next, I think, 5 years until 2019. So the next 5.5 to 6 years. So it's a good funding option for you guys to consider, and it's relevant to this week. Okay, take a look at it. Health literacy is an ongoing challenge. So as we try to transfer knowledge to our public, and this applies to really any any country, you want to get some sense. Sorry, you need to get some sense up front of, well, how well how much does our population understand about healthcare, various diseases, and so on. What's their health literacy? So in our country, in the U.S., only about 12% of Americans are viewed to be proficient in with regards to their health literacy. So Most of the country is not what you would call health literate, which means you're going to run into challenges when you try to transfer knowledge. So, as a researcher who is, you know, digging deep into your area of knowledge and inundated with your professional language, you have to realize that when you come outside and you talk to the rest of the world, that you're going to have to change your language. You're going to have to translate what you're saying, even though you're speaking English, because the English you're speaking in your research language is not the English that most of the country speaks by far. So this is one obvious challenge to translating knowledge. One good example of this is PubMed. It's called PubMed, and it's supposed to offer public access to research articles. However, if you take any member of your family who speaks English and you have them take a look at PubMed, and have them search for anything that interests them, then have them tell you what is the meaning of what they're looking at. Just have them tell you what they think the meaning of the first two or three articles are that they see pop up. Most of them won't understand the title. If they look at the abstract, if the abstract is available, the abstract is not always available, which is even more, even stranger because people can't even get a general sense of what the paper is about, even if it's exactly what they're looking for in terms of the information they're searching for. So the notion that PubMed is actually something that the public can truly access is really a bit whimsical and is a false notion. So just realize that that barrier is there, where even though we have something that we call PubMed and we say it's public accessible, it really isn't. And so that's just one example, and there are numerous out there where the public is not really getting good knowledge transfer, information transfer. They're not really hearing from researchers in a way that's easy for them to understand. There's really not a good site that captures all of the research going on in our country and other countries and provides the information in a way that the general public can understand. So at that eighth grade reading level or below, there's really no site that does that well. There are a few disease sites that attempt to do this. Medline Plus tries to provide information that's focused on prevention, treatment of disease, and so on, but they really don't address research information. So research information is just not being translated well to the public. So if your child had some rare disease and you weren't a health professional and you went to look for research on that disease, you would have a hard time digging through the information, truly understanding what's going on. And you would also have the barrier of actually having to purchase many of the articles that are written on the topic that you're searching for. So you might find that there are some great articles out there, but they each cost $30 a pop. So $30 to purchase each one. And that, for many parents, that's just not feasible. Some parents are able to pay for that, but for many, that's not feasible. And so these barriers that we've generated and created because of the way we transfer knowledge in our country can be substantial and pose a challenge for good knowledge transfer in our country, that's for sure. All right. Another example of bad translation is this U.S. Preventive Services Task Force example that I provided to you in your reading. So take a look at that, and basically it gives you a sense of, well, here's something that should have translated well to the public, and government is part of this because government helps create the U.S. Preventive Services Task Force and pays for the work that they do. But government, in trying to communicate new guidelines for mammogram testing, it really kind of fumbled the ball and really did not do a good job presenting this information to the public. And as a result, people really were disturbed by what government was saying. They were shocked in some cases by what government was saying. So this is a good example where where researchers are attempting to translate some information to the public, but they're not doing a good job translating it. And so we've got to get better. There will be more U.S. Preventive Services Task Force recommendations in the future, and so they're constantly trying to learn how to improve the way they do this. In fact, the chair of health policy here at GW is actually studying how they go about translating this information and whether they can do a better job or not. Okay, that's it for this week. Look forward to your comments on the discussion board, and take a look at my comments on your last discussion board posting. I hope all of you are starting to finish up your grant proposals. Let me know if you have any questions about them that I can address. Have a good week.